The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Let's talk about diet. We were talking about optimizing what you're eating heading into surgery, but what about on the other side? And I know you've got a good story about this because we all do. When we find out, we see someone who's not healing properly or how we expect, and then we start asking some questions. What have you experienced?
Yeah. So, essentially what you want to do as a patient is to optimize your diet with a lot of extra protein. So have a well-rounded diet, eat whole foods, multivitamins and some minerals of that nature are probably good because if you don't need them, you probably urinate them out. But if you do need them, especially in that state of post-surgery, the anabolic state, building things up, you want all of the nutrients. And when we say extra protein, honestly, it's like 100 grams, 150 grams, 200 grams of protein a day until you're fully healed up, which is a lot of protein. So
it's a lot. And so that's why I recommend some of those protein drinks, even not even smoothies, because those can be, if you can have the smoothies, great as well. But sometimes it's hard for people to consume that much at first. So if you can get a couple of those drinks down and they each have 20 grams of protein, you do a couple of those a day, that will all support what you're actually able to consume as well. And some people are so afraid of gaining weight after surgery. Like they're stepping on that scale, like I mentioned, that's not real. I always tell patients, like, we didn't add anything to you. You're going to be, if anything, later, certainly more contoured, but all that water retention can be really scary for patients. And we all love stepping on the scale after surgery. I don't know why. And so people will even try to almost like lean into the fact that they're not hungry is almost like a early diet. This is not the time to diet. This is the time to eat healthy and well, and your metabolism is on fire because you have so much healing to do. So you don't need to worry about gaining weight. And if you don't eat enough, then we'll see things just fall apart. And we can always tell who's not healing because, or who's not eating, because if you don't eat enough, you just don't have the building blocks to create an appropriate wound healing environment, appropriate scars, and you won't heal as well.
That's the story of my patient. So she actually had liposuction and she had a breast augmentation and lift. And she was not healing after 1 week, after 2 weeks, after 3 weeks. So finally I said about 2-3 weeks, I said, I'm sort of at my wit's end here. Did you radically alter your diet? She says, well, I didn't really radically alter it. I just decided to go vegan after surgery to keep the weight off. Yes.
Not the time. Also, it's one thing. If you're doing veganism appropriately, you have to make sure you're getting complete proteins, all that. It can be difficult to do, especially but to initiate that after surgery, especially if you're not doing it properly, that's not the time. It's not the time to radically change your diet. I totally agree.
So the good news was we just went crazy with the protein. And I just said, look, why don't you just go carnivore or omnivore like you were before surgery, at least for a week or two after, starting today. And magically she healed up. So she eventually did go vegan, but she waited until she healed up after her operation.
Yes, that sounds like a much, much better idea.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.